Hi, I'm Samantha and this is my suctioning video. So I'm going to enter the patient's room, perform hand hygiene, close the curtain for privacy. Come in. Hi, Mrs. Jones. I'm Samantha. I'll be your student nurse today. You do have an order in your chart for suctioning, and it does look like you need some suctioning. We did administer pain medication for her about a half an hour ago. And Mrs. Jones, if you experience any respiratory distress at any time, we will stop the procedure. So then I'm going to come over and turn on the suctioning. Well, first I'm going to raise her up to a semi-Fowler's position because she is conscious. If she wasn't conscious, I'd put her in the lateral position. And now I'm going to turn on the suctioning. I want it to be in between 100 and 120. So I'm going to put on clean gloves to check the pressure. Take this and occlude the end of it. And it's like right on 120, so good to go. I'm gonna set this here. Take my gloves off. Throw them in the trash. I'm gonna bring the ambu bag over close to her and hook it up to another oxygen source. Over my trash and put it close to my work spot. Cover her chest with a pad, keep her gown clean and dry. I'm going to come over and open my sterile field. I'm going to grab this, open it, set it aside. Grab the saline and make sure that it is saline and not expired. Pour that into our basin. Place the cap and put that away. And I'm going to put on my face mask. And put on my sterile gloves. And I'm going to take out the catheter, wrap it around my dominant hand, and come over and with my non-dominant hand plug in the suctioning to it. And I'm going to make sure it's working and lubricate it. And I'm going to come over and remove her oxygen. Hyperventilate her 3 to 6 times.
But the others are safe.
And then suction, inserting the catheter in until I meet resistance, about 3 to 6 inches. And then as I twist and pull out, occlude. Wrap that back up. Hyperventilate again. Replace her oxygen. Come over here. Run the saline through again to clean it. You'd wait 30 seconds to a minute in between. Remove her oxygen once again and hyperventilate. And once again, suction. Hyperventilate. Replace her oxygen. And clean this again. We would suction up to 3 times if necessary, but we would not suction more than 3 times. So she looks good for suctioning of the trach, so then I'm going to suction her mouth. Inserting it in and going along the side of her mouth and teeth line, and same thing, twisting and occluding as I pull out. I would come and do the other side of her mouth. Probably clean that out a little bit and remove it. I'm going to hold this in the glove, remove my glove. Dispose of those in the garbage. Remove my PPE without removing my glasses. I normally don't wear glasses, so that wouldn't be a problem. Okay, and throw that away. I'm going to do hand hygiene and offer Mrs. Jones oral hygiene afterwards. And I'm going to remove this, throw it away, turn off my suctioning, remove Mrs. Jones. I'm going to reassess Mrs. Jones, assess her respiratory stats, her rate, effort, and her O2 stats, and I'm going to listen to her lung sounds. Then I'm going to put her down back into a comfortable position, perform hand hygiene again, and we're done.